The Ozempic paradox. Have you ever wondered what happens after successful weight loss? Not during the journey, not while the scale is moving, not while everyone is celebrating, but afterward, when the goal has been reached, when the weight is gone, when the medication has worked. What happens next? Because for decades, medicine focused almost entirely on losing weight. Very little attention was paid to keeping it off, and that's where the real story begins. Today, we're going to explore one of the most important discoveries emerging from obesity medicine. A discovery that may completely change how we think about obesity, metabolism, GLP-1 medications, and long-term health. Because the biggest challenge in weight loss has never been losing weight. The biggest challenge has always been maintaining it. And modern science is finally beginning to understand why. Let's start with the difficult truth. Most weight loss programs fail. Not because people don't lose weight, many people do. The problem is what happens afterward. Numerous long-term studies have shown that significant weight regain is common following successful weight loss. In many cases, people regain a substantial portion of the weight they worked so hard to lose, sometimes within months, sometimes within a few years. And this isn't simply about willpower. In fact, one of the biggest misconceptions in health is the belief that weight regain represents personal failure. Modern biology tells a very different story. Imagine your body possesses an internal thermostat, not for temperature, but for body weight. Scientists sometimes refer to this concept as the body weight set point. The theory remains actively debated and refined, but the central idea is compelling. The brain constantly monitors body fat, energy reserves, hormone signals, and nutrient availability. When significant weight loss occurs, the brain may interpret that change as a potential threat. Not because weight loss is dangerous, but because the brain evolved in a world where food scarcity was common. From an evolutionary perspective, losing stored energy wasn't necessarily a good thing. It could mean famine, and the body responds accordingly. Something remarkable happens during weight loss. Appetite hormones change. Satiety signals change. Energy expenditure may decline. Food becomes more rewarding. Hunger often increases. The body begins fighting to restore what was lost. Not because it wants to make you unhealthy, because it wants to keep you alive. The tragedy is that ancient survival biology now operates inside an environment of food abundance, and that's where obesity becomes incredibly difficult to manage. This brings us to one of the most significant medical breakthroughs of the past decade. GLP-1 medications, drugs such as semaglutide and tirzepatide, medications originally developed for diabetes management, but which soon revealed something extraordinary. People weren't just improving blood sugar control, they were losing substantial amounts of weight, sometimes life-changing amounts. And for the first time, many patients described something unusual. Food noise became quieter, cravings diminished, satiety improved. The constant battle with hunger became easier. Now here's where things become fascinating. Recently, researchers began asking a new question. What happens after maximum weight loss? What happens when patients achieve the best results possible? Do they maintain those results? Do they regain weight? Does dose reduction matter? Does stopping therapy matter? And the answers may reshape obesity medicine for decades. Imagine a patient spends more than a year losing weight successfully. Their metabolic health improves, their mobility improves, their blood pressure improves, their confidence improves. Life changes dramatically. Then one day, the medication stops. What happens next? Many people assume the body simply maintains the new weight. Unfortunately, biology is rarely that cooperative because the underlying metabolic drivers often remain active. The same biological systems that resisted weight loss in the first place haven't disappeared, they've merely been managed. This is one reason obesity is increasingly being viewed as a chronic disease, not a character flaw, not a failure of discipline, a chronic metabolic condition, much like hypertension or asthma or diabetes. We don't expect blood pressure medication to permanently cure hypertension after a few months. We don't expect asthma therapy to permanently eliminate asthma, yet many people expect obesity treatment to function differently. Modern evidence suggests that expectation may be unrealistic. Let's pause for a moment, because this idea is emotionally challenging. Many people want a finish line, a moment where treatment ends and the problem disappears forever. That's understandable. But biology often operates differently. The human body is dynamic, continuous, adaptive, and many chronic conditions require ongoing management, not because treatment failed, but because treatment succeeded. Now let's discuss something rarely mentioned in public conversations. Weight loss and health are not identical, they're related, but not identical. The scale tells only part of the story. What matters even more is what is happening beneath the surface. Metabolic health, inflammation, insulin sensitivity, sleep quality, recovery, muscle mass, cardiovascular health, stress physiology. These factors determine long-term outcomes, not just kilograms. Imagine two individuals who lose exactly the same amount of weight. One preserves muscle, improves sleep, improves fitness, improves metabolic markers. The other loses muscle, becomes sedentary, develops poor recovery patterns. The scale may show identical results, yet the biological outcomes are completely different. This is why the future of obesity medicine cannot focus solely on weight. It must focus on metabolic health, and this is where wearable technology enters the story, because medicine is moving beyond snapshots, toward continuous understanding. Historically, we checked weight occasionally, maybe once a month, maybe during a clinic visit, but physiology changes every day. Sleep changes every day. Recovery changes every day. Stress changes every day. Activity changes every day. The future belongs to people who understand those patterns. Think about what really determines long-term success, not a number on a scale. Behavior, sleep, recovery, stress management, movement, consistency. These are the systems that support sustainable health, and increasingly, technology allows us to observe them objectively. Heart rate variability, sleep quality, recovery scores, activity levels, readiness. Not because numbers are magical, but because awareness creates opportunity. One of the biggest risks after successful weight loss is becoming overconfident. People assume the battle has ended. The biology says otherwise. Maintenance may actually be the most important phase, the period where new habits become permanent, where muscle preservation becomes critical, where sleep becomes important, where stress management matters, where recovery matters, because long-term success is rarely built through dramatic actions. It's built through sustainable behaviors, repeated consistently. Let's talk about muscle, because this may become one of the most important conversations in the GLP-1 era. Rapid weight loss can include both fat and lean tissue, and muscle matters enormously. Muscle supports metabolism, glucose regulation, physical function, healthy aging, longevity. Preserving muscle should be a major priority during any weight loss journey. This is why resistance training, adequate protein intake, recovery, and sleep remain essential. The future isn't simply thinner humans, it's healthier humans. The next decade may witness a profound shift in medicine, away from reactive care, toward proactive metabolic intelligence. Not simply asking, how much weight did you lose? But asking, how healthy is your physiology becoming? How are you sleeping? How are you recovering? How resilient is your nervous system? How stable is your metabolism? These questions matter far more than most people realize. At OXYZEN, this is the vision that excites us most. The future isn't more data, it's understanding. Helping people connect the dots between sleep and metabolism, stress and appetite, recovery and performance, physiology and behavior. Because when people understand their biology, they make better decisions, and better decisions create better outcomes. So if there's one lesson I want you to remember from today's episode, it's this. The future of obesity treatment is not weight loss. The future is weight loss maintenance, and the future of weight loss maintenance is understanding metabolism, understanding recovery, understanding physiology, understanding the signals your body sends every day. Because the most important question isn't, how much weight can I lose? The most important question is, how healthy can I become? I'm Dr. Yende. Thank you for joining me for another episode of OXYZEN Health Intelligence. Remember, the goal isn't simply to weigh less. The goal is to live better, move better, recover better, and understand your biology well enough to sustain health for decades to come. I'll see you in the next episode. Have you ever wondered what happens after successful weight loss? Not during the struggle, not while the scale is falling, not while everyone is celebrating, but afterward, when the goal has been reached, the weight is gone, and the medication has done its job. What happens next? For decades, medicine has focused almost entirely on losing weight. Very little attention was paid to keeping it off, and that's where the real story begins. Today, we'll explore a discovery from obesity medicine that could change how we think about metabolism, GLP-1 drugs, and long-term health. Because the biggest challenge hasn't been losing weight, it's keeping it off, and modern science is finally starting to explain why. Here's a difficult truth. Most weight loss programs succeed in the short term, but fail in the long term. Many people do lose weight. The problem is what comes next. Numerous long-term studies show significant weight regain is common, often within months or a few years. This isn't simply a failure of willpower. One of the biggest misconceptions is that weight regain is a personal failing. Biology tells a different story. Imagine your body has an internal thermostat, not for temperature, but for body weight. Scientists call this the body weight set point. The idea is still debated and refined, but the central concept is clear. The brain constantly monitors fat stores, energy reserves, hormones, and nutrient availability. When you lose a lot of weight, the brain can interpret that change as a threat. Not because losing weight is inherently dangerous, but because our biology evolved in a world where food scarcity was common. Losing stored energy could mean famine. So the body fights back. During weight loss, something remarkable happens. Appetite hormones shift, satiety signals change, energy expenditure often falls, food becomes more rewarding, and hunger intensifies. The body works to restore what was lost, not to make you unhealthy, but to keep you alive. That ancient survival biology now runs into an environment of food abundance, and that's why obesity is so hard to manage. Enter GLP-1 medications, semaglutide, tirzepatide, and others. First developed for diabetes, they revealed an extraordinary side effect: dramatic weight loss. Beyond improved blood sugar control, many people lost life-changing amounts of weight. For the first time, patients described something different. Food noise calming down, cravings losing their grip, satiety improving. The relentless battle with hunger became easier. But new questions followed. What happens after the maximum weight loss? If someone spends a year or more losing weight, their metabolism improves, mobility improves, blood pressure falls, confidence rises, life changes. Then one day the medication stops. What next? Many assume the body will simply keep the new weight. Unfortunately, biology rarely cooperates that neatly. The metabolic drivers that fought weight loss in the first place often remain active. They've been managed, not erased. That's why more experts view obesity as a chronic disease, not a character flaw or lack of discipline, but a long-term metabolic condition. We wouldn't expect hypertension or asthma to vanish after a few months of treatment, and obesity may be no different. That idea is emotionally hard. People want a finish line, a moment when treatment ends and the problem disappears. That's understandable, but the body is dynamic and adaptive. Many chronic conditions require ongoing management, not because treatment failed, but because treatment worked. Weight loss and health aren't the same thing. They're related but not identical. The number on the scale is only part of the story. What matters more is what's happening underneath. Metabolic health, inflammation, insulin sensitivity, sleep quality, recovery, muscle mass, cardiovascular fitness, and stress physiology. These factors determine long-term outcomes, not just kilograms. Imagine two people who lose the same weight. One preserves muscle, improves sleep, raises fitness, and improves metabolic markers. The other loses muscle, becomes sedentary, and develops poor recovery habits. The scale may read the same for both, but their biological outcomes are worlds apart. That's why the future of obesity medicine can't focus solely on weight. It must focus on metabolic health. This is where wearable technology becomes important. Medicine is moving from snapshots to continuous monitoring. Historically, we checked weight occasionally, maybe at a clinic visit. But physiology changes daily. Sleep, recovery, stress, and activity all shift. The future belongs to people who understand those patterns. Metrics like heart rate variability, sleep quality, recovery scores, activity levels, and readiness don't work magic, but they give actionable insight. Awareness creates opportunity. One of the biggest risks after weight loss is overconfidence. People assume the battle is over. Biology says otherwise. Maintenance may be the most important phase, the time when new habits solidify, muscle preservation matters, sleep becomes a priority, stress is managed, and recovery is optimized. Long-term success usually isn't built on dramatic actions, but on sustainable behaviors repeated consistently. Let's talk about muscle, because this may be one of the most important conversations in the GLP-1 era. Rapid weight loss often includes both fat and lean tissue. Muscle matters. It supports metabolism, glucose regulation, physical function, healthy aging, and longevity. Preserving muscle should be a major priority through resistance training, adequate protein, recovery, and sleep. The future isn't just thinner people, it's healthier people. Over the next decade, we may see a profound shift from reactive care to proactive metabolic intelligence. Instead of asking, how much weight did you lose? We'll ask, how healthy is your physiology becoming? How are you sleeping? How are you recovering? How resilient is your nervous system? How stable is your metabolism? These questions matter far more than most people realize. At OXYZEN, that vision excites us. The future isn't just more data. It's understanding, helping people connect sleep and metabolism, stress and appetite, recovery and performance, physiology and behavior. When people understand their biology, they make better decisions. Better decisions create better outcomes. So remember this, the future of obesity treatment isn't only weight loss, it's weight loss maintenance. And the future of maintenance is understanding metabolism, recovery, and physiology, the signals your body sends every day. The most important question isn't, how much weight can I lose? It's, how healthy can I become? I'm Dr. Yende. Thank you for joining me on another episode of OXYZEN Health Intelligence. The goal isn't simply to weigh less. It's to live better, move better, recover better, and understand your biology well enough to sustain health for decades. I'll see you in the next episode.